video was inspired by a chat I had with a senior nurse. She is way ahead of me in nursing, like she's even retired and she's achieved a whole lot in nursing. So she had a chat with me and was seeking advice on what I would suggest, if she should come to the UK or not. So to work, obviously. So in my head, I was just thinking, Ma, with all this achievement, do you really want to come to the UK, considering the work politics, considering the stress, that affiliated, the expectations that attached to the job? So I was just thinking, and then I was inspired to make this video because I also understand that there are some people in that situation. You may not be an elderly nurse, you may not be retired, but you just feel that you are tired of workplace politics and you want to work independently and thrive. So this is the video that is ideal for you. So let's get into it. So I'm just going to tell you the types of nurses that we have, or nursing jobs that we have, and what would be more ideal for you if you are the type of person who wants to work independently and thrive without having someone watching your back or you getting into trouble easily, because that is why most people are scared of this job, especially if you're an immigrant. So let's get into it. We have the first type of nurses, which are the care providers. These are nurses who work directly with the patients or with the clients. Examples of them would be staff nurses. You find them on the wards, you find them in care homes. We have the community nurses, the palliative care nurses, the mental health nurses, the learning disability, etc. So these are people who work directly with the patients or so they render care directly to the patient. Another type of nurses we have, they are the educators or the innovators. So this set of nurses, they contribute to the nursing body by giving information that enhance knowledge. So they are more into research. So we have the research nurses, we have the health education nurses. Sometimes they interact directly with the clients to give them health education, and sometimes they just publish books, they just make podcasts. Sometimes they are influencers, or they are mentors like myself, just the way I'm doing this video and the likes. So those are some types of nurses. So the type of nurses that we are really into, or we are interested in this video, they are the care evaluators. So they are the care evaluators or care coordinators. So one peculiarity about this type of nurses is that they do not render care directly. Like I said, they evaluate care, they coordinate care. So they are not the ones that will be having people watch their backs or something. They won't be, so they are the ones that people will be watching out for, if you understand what I mean. So that is one of the things you can do if you're a type of nurse, if you feel that you've done it all, before coming to the UK or before migrating to the country that you're in, that you've done it all. You just want that peace of mind. You just want to be able to work on your own and thrive. So these are the type of nursing job you should be looking forward to. And I should mention at this point in time that most of these jobs do not carry the title nurse. Most of these jobs, they do not have anything that would suggest to you that nurses can actually do it. So there are jobs within the healthcare sector that can be done by nurses. So I'm going to give you a couple of them, and I would also want you to research on them, research on the positive and the negative sides of them, and make informed decision. But I can assure you that this type of jobs are likely to give you peace of mind as compared to being a direct care provider. So the number one would be the quality improvement nurse. So your job is to assess the quality of care and to ensure that it meets up with standard. You're not rendering the care, you're providing advice, you're providing guidance, you are just making sure that the nurses who offer direct care are sticking with whatever is expected of them, in guidelines with the Nursing and Midwifery Council. You are not the one that is being evaluated, you're the one evaluating others. There are so many trusts that have this type of position, but you won't see the name nurse attached to it. So you have to do your research. And I'll always tell nurses that focus on the requirements, not the job title. The requirements will tell you if you meet the criteria, not the title most of the times. Just pen that down. That's the secret. Another type of nurses that we have, or job that we have that nurses can do, is the health visitor role. This cannot be overemphasized because you are visiting, you're not rendering care, but you're evaluating the care being rendered by other multidisciplinary team. You're evaluating the effectiveness of the care, and you're going to be communicating this to members of the MDT. This type of job assures you peace of mind because you are only going to report on what you are, seeing, what you've observed, and you're going to make recommendations. Your recommendations are to be actioned by others, if you understand what I mean. Less responsibility for you. If you've given birth in the UK, you'll be familiar with health visitors because they come in, check children, and all that. And before you think of becoming a health visitor, be sure that you're the type that is comfortable, going to people's homes. Not everyone is comfortable visiting others. So you want to be sure that you're comfortable going to people's homes, and you are always professional all the time. So if you are the type that within you this is not suitable for you, you don't want to go to people's homes and cause chaos or something. So you have to be professional at all times, obviously. So you have to evaluate that within yourself that you're suitable for this type of role. So the third type of job I would recommend is the social worker role. Notice all of these jobs, you may have to take one course or the other in order to fit for the job. Oh, I forgot to mention, for health visitors in the UK, you're automatically employed as a band 6 in most of the trust. Once you're qualified, then you become band 6, not band 5, which is, an additional star to that room. So as I was saying, the third one would be social worker. So social worker is more or less the same as the health visitor role. Is closely aligned, although the health visitors, they will communicate with social workers. So the social workers at the same time, they would communicate with the MDT. So, and again, you're making recommendations for the vulnerable. You would need to have sound knowledge of safeguarding. And I need to tell you at this point, if you are the type of person that is emotional, you may find social work role or social worker role very difficult. As a social worker, you have to be well grounded in information that has to do with safeguarding, because people's life, people's welfare depends on you. While you're not rendering the care, you have the responsibility to safeguard them. And I should also mention that if you're the type who normally procrastinate, you can't work as a social worker, because as a social worker, you are required to act promptly. Where people's lives, where people's well-being depends on you, then you have to act promptly. So that's one of the things that you need to be aware of. Another type is the discharge coordinator. These ones, you will find them mostly in the hospitals. So these ones, or this type of people, they are the ones who coordinate discharge, who make sure that the beds are free, who make sure that people are evaluated and all that. I'll give you the responsibility or the job to go and search for the requirements of discharge coordinators. So these ones, you're not rendering care, you are ensuring that there is good flow, from discharge to admission, there is good flow. So there is limited direct patient care. You are going to be communicating with the team in your hospital, unit managers, the ward managers. Those are the ones you really have to communicate with, not the patient. So that is that. And lastly is the infection prevention and control nurses. I think this is just a soft work. I know someone who told me that she's doing this job, and I believe she also mentioned that she has the privilege to also work from home. What they do essentially is to communicate with clients and just to evaluate the progress, of their, maybe they have sustained the wound or the likes. Some of them, they go on inspection on the wards to make sure that yes, people are sticking with the guidelines of infection prevention and control. So as you can tell, we did not talk about anything IT, anything, because I understand that people who just want peace of mind, there is limited thing you want to be stressing about. I mean, you don't want to get worked up on the computer. So we're not talking about IT. So those are the recommendations that I would make, and I hope you would also research on it. What would make you to work independently and not to be watching your back all the time, or would assure you peace of mind. So yeah, I hope you enjoyed the video. And if you've watched to this level and you are yet to subscribe, tell me why. Tell me why. If you need me to help you with an application, if you've seen a role that you're interested in and maybe you've tried it in the past and you failed, or you just need me to give you an insight, contact me so we can book a consultation and all, and we discuss it. Thank you very much, and thank you for watching this video, and I hope to make another video very soon. And if you have any content, any advice, anything you would want to suggest, please use the comment section. If you need me to make a video just to give you clarity on some things, you can drop it in the comment section and I'll be there. Thank you. Bye.